That way they know I'm here.
Aside, please. Okay, good. What would you do if someone you loved suddenly stopped breathing and went into cardiac arrest? Would you like to idly stand by, or would you like to jump in and help pump their heart until the medics arrived? Or what if you're at your child's sporting event and suddenly one of them just collapses right in the middle of the floor? Would you rather step in and do whatever you could to help save their life, or the life of your child, or your mother, your father, anybody, just anybody's life? Cardiopulmonary resuscitation, also known as CPR, is a manual application of compressions to the chest in an effort to maintain viability of organs until help arrives. In the case of cardiac arrest, do you know what to look for to determine if someone needs CPR performed? According to the American Heart Association, cardiac arrest is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. Cardiac arrest is sudden and unexpected, and it can happen to anyone at any time in the blink of an eye. Each year, over 350,000 cardiac arrests occur outside of the hospital. Unfortunately, almost 90% of people who suffer out of the hospital cardiac arrests die. If someone, anybody who knows CPR, can jump in and start within the first few minutes of cardiac arrest, it can double or even triple a person's chance of survival. Would you want your chance of survival to be higher? Now that you know a few facts about cardiac arrest, let me tell you a little bit about the basics of performing CPR. First, you're going to check for a pulse. You can check at the carotid artery in the neck, and if no pulse is present, you're going to put your ear by their mouth and listen for sounds of breathing. If there's no pulse and there's no breath, you're going to place them on their back on a hard surface and prepare to start CPR. You'll want to place your hands one on top of the other in the center of their chest and use the weight of your body to administer the chest compressions. The goal is to compress at a depth of 2 inches and at a rate of 100 to 120 compressions per minute. In order to get that depth, you will have to crack the sternum. You will hear it and you will feel it and not like it, but it is necessary. In my experience, for me, it is easiest to reach the right rhythm by singing a song in my head that has the right beat to achieve the proper amount of compressions per minute. A couple of examples are Staying Alive by the Bee Gees and Another One Bites the Dust by Queen. It is proven that these beats allow for the right compression rate. Achieving the right rate and rhythm are vital to performing proper CPR. When performing compressions, you are literally making their heart beat. You're manually pumping blood throughout the body to the brain and organs. Any loss of oxygen is detrimental to the brain function. Keeping the flow of blood to organs is vital and increases the chance of the person's survival. Now that you know the basics of cardiac arrest and the importance of performing CPR, will you go and get certified? Do you want to be someone who can step in and save a loved one's life, or the life of your child's teammate, or your spouse? Cardiac arrest can happen at any time to anyone. The average cost in our area to become CPR certified is $50. So for a small amount of money and 8 hours of your time, you have the potential to make a difference. So I challenge you to go out and get certified. So if the need arises, you have the ability and knowledge to act and potentially save a life.